Hey guys, this is pharmacist Curtis Alexander. In this video, I'm going to tackle a viewer question, which was how do you taper or wean off Tegretol, which is primarily used to treat seizures, but does have other uses. So in this video, I'm going to cover do you need to do it, the best way to do it, and give you an example at the end. So let's hop right into it. So first of all, is it necessary? And it's one of those medications that, yes, this is something that you have to go off slowly, and you're going to be surprised at how slow you do actually have to go off it. One of the things we're trying to avoid, if you're using Tegretol to treat seizures, it does increase your risk of having those seizures if you go off it too fast. We have other uses for it. People that are using it for psychiatric disorders, neuropathic pain, some of these other uses, you want to go off it slow in those cases as well, because it does increase your risk of seeing withdrawal symptoms. Patients can complain of hallucinations, headaches, insomnia, tremors, those sorts of things. So regardless of what you're using Tegretol for, yes, you do have to go off it slowly. Okay? Are there exceptions? Now, I want to point out one thing. If you're of Asian descent, sometimes there can be basically a genetic reason that you can react to carbamazepine, have a very serious adverse reaction. It's called serious cutaneous adverse drug reaction, and so it breaks out in this crazy skin rash basically. But so if you're Asian descent, you start it and that happens, that would be a case where we'd want to stop it quickly because it's more of an emergency situation. Other than that, we got to go off it slow. So how slow? You're looking at 2 to 6 months. Sometimes a doctor may go off it in a month, but I always caution people, it's like, if you try that, be very careful to pay attention if you're seeing these hallucinations, those sorts of things. And the other thing is, if you're using Tegretol for the bipolar component, you really want to watch those people when they're going off it, that they don't get the manic episodes coming back. So I always tell people 2 to 6 months. Can it happen sooner? It's up to you and your doctor, but I wouldn't count on much quicker than that. So how do you do it? For example, if we have a patient who's on 400 milligrams a day, so 200 milligrams, BID is twice a day, I would drop that person, say 50 milligrams a week. And then over the course of a couple of months, they should be off that. So the first week it'd be 150 in the morning, then 200 in the evening, then 150 in the morning, 150 in the evening the next week, and keep dropping it down. If the patient's doing really well, you can maybe go a little quicker. But again, Tegretol is one of those ones we want to go slow. So let me know in the comments, have you taken Tegretol? Did you go off it? If you did, how did that go? Those types of comments are really helpful for the other viewers. They're helpful for me to get your feedback. So speaking of helpful, I hope this video was, and I will see you in the next one. Thanks.